This is the Art Beauty Podcast where we tell the real truth about the fake shit. I'm Amber Mills, and today my fabulous and gorgeous co-host is Dr. Shirley Madhère. She's the founder of Holistic Plastic Surgery. She's also the host of the Forever Fab podcast, and she created Jet Set Beauty RX, which we are going to be talking all about today. Welcome to the show, Dr. Madhère.
Thank you so very much, beautiful Amber, for having me on your show. I'm excited.
I'm so excited. So I get a lot of different pitches being in the beauty industry. And one of the things that came across my desk was Jet Set Beauty RX. And I think that you all will understand why I went gaga over this, because you have, first of all, the most luxe and delicious mobile van unit that has a full, gorgeous setup in it.
Yes.
And you are providing services to people on the go. Things like what? Botox, facials.
Yes.
Tell us more.
Injectables, fillers, vitamin infusions. So Jet Set Beauty RX, I founded because I needed to elevate the game, right? So it is an elevated house call. And I've been doing house calls for probably as long as I've been in practice. And I think that's about 15 years.
I mean, girl, yeah, this is like takes the Botox party to a whole new level. I love it.
Yes, it does take the Botox party to a new level, but it's only a party of two in that van. It's just me and the patient. And so that's one of the reasons why I don't perform large scale Botox parties, is because I'm just concerned about, the safety and being able to provide individualized attention to each and every patient who's there, because everyone's forehead is different. Not everyone requires the same dose of Botox. And even if they did, not everyone wants the same result. So in order to be able to maintain that standard and to be able to provide individualized, personalized, customized, private services on the go, on your time, in your time, always on time. I created Jet Set Beauty RX.
Okay, now for everybody, I hate to break the news now. So Jet Set Beauty RX is really only available in like the New York area. For now. But what I did want to bring Dr. Madhère on for everybody who's listening today is to talk a little bit about some of these mobile beauty and things like Botox parties when you're doing a house party, some of the things that we need to be considering, and then we can talk about all the goods that she offers right there and that gorgeous luxury mobile med spa. So when it comes to, let's start with the Botox party. I feel like these days, it seems like everybody and their dentist is doing Botox. What are your thoughts on that? And what are things that we maybe want to consider before inviting our besties over for a little, injectable Botox party?
For a little party, for a little pretty party.
A little pretty. Oh, I like it. I was trying to think of something clever, and I was like, my brain was just blah, blah, blah. Yeah, pretty party. Mm-hmm.
A pretty party. Well, listen, to each her own. I don't perform, again, Botox parties with 4, 5, 6, 7, 8 people. That's just not my thing. That's not that's not a way that I choose to practice. I am, no judgment. There are people who do that and they do very well at it. And again, I'm not for everyone, and not every patient necessarily is for me. So my particular professional concerns about having large groups just sort of go one after the other, getting things done, is that I feel that I'm not able to provide that individualized one-on-one, precious time with them to be able to evaluate and discuss exactly what they need, perform the injection, and then just really spend that quality one-on-one time. So that's what I prefer. That is how I prefer to practice, not only in my office, but also through Jet Set Beauty RX. And I think it's important that I know what happens at pretty parties. It's fun, it's lively, it's dynamic. Often there's alcohol involved, and that's not something I would necessarily recommend. And obviously the surgeon or the practitioner should not be drinking. That's clear. That is so clear. But even for the participants, right? Because sometimes we don't really fully know the effects of alcohol on the skin, right? At least in the short term. Does it cause does it cause more bleeding? Does it cause more bruising? Does it cause you to not necessarily feel not so much? And then a little later, you're like, wait a minute, that's not where I wanted it to go. So there are a lot of moving pieces involved. There really is a lot going on during an initial evaluation and a consultation. And I personally need that time to be able to connect with the person who's about to undergo an injection and make sure that they are totally of sound mind, right?
Well, you know what, that you bring up a good point, and I want to talk about this because, again, trying to make this more available to our, United States, but also international listeners. Thank you very much for all of you listening to this. I don't even know how they do this in different languages, but I'm so honored. So one of the things I think, personally, when I go to get Botox, I don't drink for like a good 4 or 5 days before, because personally for me, I will bruise really badly. And I've been to the doctor after having a couple and he's like, you drank last night. So bruising, I think, is something that's cautious, but you bring up a good point. A couple of glasses of wine in, you might be like, oh, I'll get lip filler, especially when there's a bunch of people around who are like,
yes,
all doing that. That probably can be something just to consider. Maybe if you are hosting one of these parties, maybe don't go heavy on the booze.
Yeah, exactly. I mean, the power of peer persuasion really is something that ought to be considered. It's easy. I could totally see how someone would be at a pretty party and 3 or 4 people are doing lip fillers, and the van is right there and everything is at your disposal, or perhaps someone is helping to subsidize part of the fee for the procedure. It's easy to say, yeah, sure, okay, I'll try it. But perhaps that was never really consistent with what you were about. That was not part of your beauty philosophy, right? So it's interesting what happens.
I've had to learn the hard way because, one of the benefits of working in beauty, we get invited to a lot of, new technology, new lasers, or, hey, come see this makeup product. And also we're going to have a doctor doing filler. And I've learned the power that sometimes you have to just say no, because sometimes people will be like, oh my gosh, I could just boost this and do that. And if you're not really ready, and if you haven't really thought of it, it's something to consider about. Also, filler in general, there, we call these kind of not, well, actually, do you call that like a non-invasive procedure? I guess.
Not really. I call it minimally invasive because
minimally, thank you.
Right. Yeah. We're disrupting skin.
and you are going to swell, right? I mean, I've never had my lips filled. I'm really tempted every time I go into the doctor, but isn't it like 4 days afterwards that you could be like, for people who didn't say, I just made a big duck lip face.
I know, right. And now I'm doing it too. But actually it could take anywhere from, 3 days to up to 2 weeks. Everyone is different. Right. I prep my patients before procedures, obviously before surgery, but even before minimally invasive procedures such as injectables. And I help prep them with, modifying their diet, believe it or not, because you want to be able to reduce the inflammation that currently exists in your body. And one of the more effective ways to do that is with modifying what you eat. I also have them take, arnica, some vitamins pre-procedure. And it sounds like it's a lot to do and it's high maintenance, but it helps to reduce the incidence of excessive bruising, prolonged swelling, irritations, etc. So that is something I have my patients invest in pre-procedure. That really does help.
Girl, before I got my boobs done, which I thought was expensive, my doctor sent me a list of supplements I needed to take. And let me tell you, that was expensive, but you know what?
Worth it.
Yeah. So, going back to these parties, it's really clear that one of the things, I've never been invited to a pretty party, so I'm not speaking from experience.
Because you don't need it. You're like totally pretty already. So
no, oh, please, girl. Thank you to all of the doctors who do all of the Botox and all of the lasers and all the things. I don't lie about it. I am.
Well, you have a fabulous team. You have a fabulous team.
Well, thank you. So when we're doing this, one of the things to be considering is that you by default are going to lose some of that personalized, individualized attention.
Unless you're in a Jet Set Beauty RX fan, in which case it's just me and you.
Correct. So you know what? But which maybe lends itself to saying, we're talking about sort of these mobile beauty services in general.
Yes.
If it's a one-on-one, something to consider, right? Because you're getting that personalized attention. Another thing that I want to point out, because I went on jetsetbeautyrx.com and drooled over that van, which was like the only limo I ever want to ride in. I suggest you go and take a picture. But here's the thing. It looked like a doctor's office. So very clean, a professional medical chair. How, when we're doing these parties, let's say in somebody's living room or at the office, is hygiene something that we need to be concerned about?
Absolutely. Again, I've been doing house calls for about 15 years. And this also, the question of hygiene, the question of space, the question of potential contamination, comfort, both for me, the injector, as well as the patient. So these were a lot of the factors that I took into consideration when I was creating Jet Set Beauty RX, or the mobile version of Jet Set Beauty RX, because there would be times when I walk into a fabulous person's home. I mean, it's a fabulous home, but there wouldn't necessarily be an appropriate space for me to, lay my tools out. And I'm a germaphobe, like I'm sure many physicians are. And it was just uncomfortable for me. Now, of course, I cleaned and sanitized. I wound up sanitizing somebody's entire kitchen one time. But that is something to take into consideration. You don't want your syringes and your needles, granted, even though you put some padding on there, you really don't want them in proximity to where, somebody's son just had a steak or hamburger a few minutes prior. And speaking of, comfort, it is important for both the patient and the surgeon or the injector to be comfortable, because obviously body position is going to affect your ability to do the procedure properly. So I have had experiences where I've been, on my knees getting things done. I'm sitting next to somebody's futon and my hip is next to their ear, and we get it done. But in my opinion, those situations were not necessarily ideal. So again, another impetus for me to take the house call to the next level.
I mean, I'm just thinking about when I've had somebody come here to do a blowout, right? And like you said, if you don't have a barber chair, it becomes difficult because you're not the right height. So I can only imagine, and then the lighting, right? When you have makeup, and now I've got ring lights up the wazoo, but you still want that. You want to make sure the person is sticking the needle into the correct area of your face. Okay. So things to be considered if we were doing these parties would be things like, again, hygiene. Is there anything else that kind of, since you used to do house calls and have now elevated that, were there any other things that, for people who are listening, who might be considering mobile beauty services that are not Jet Set Beauty RX, should be thinking about?
So you mentioned hygiene and potential for contamination, important. Lighting, position of both the injector and the client, if you want to call them a client. And not only that, privacy.
Right. You don't want your 2-year-old running through and seeing mommy with a needle in her face.
Or your neighbor, or, your husband or boyfriend or significant other,
they don't need to know.
Spouse.
They don't need to know.
You know what I mean? I mean, some of them like to know, some of them don't need to know. Your nanny, if you're so lucky to have one of those, et cetera. I think there's some mystery that we should all keep as women, just a little bit of mystery.
Oh, for sure. Oh, for sure. Whenever I leave my dermatologist after getting Botox and he's like, do you want the receipt? I'm like, no evidence. Nobody needs to know. No one needs to know. My credit card and me.
Right. So
me and Amex, that's it.
Right. Yeah. Privacy is paramount. And again, there are some people who like to be able to, show their procedures on social media. That's wonderful. That's fantastic. But for some people, they really do value the privacy, as they would say, or the privacy. And Jet Set is able to offer that. But if you're at a pretty party, then clearly that's not necessarily the most important thing for you. But some of those other factors we discussed should definitely be taken into consideration.
So are there certain procedures, when you were doing house calls, I mean, aside from Botox and let's say injectables, that are the most popular, and are there any that you would say to people listening, hey, really, you should never do this in a home setting. You really should be in a professional medical setting?
Never do surgery in a home setting. Never do, even procedures such as, earlobe repairs, anything that requires an incision, suturing, no. Now, PRP even, that isn't something that I do in the mobile aesthetic unit because you need the equipment to be able to spin things down and you have a few different things going on at the same time. So I don't provide PRP yet, at least in stage 1 on through Jet Set Beauty RX, but there are some things that do require a certain amount of space, and some procedures lend themselves to having stages or doing sort of one thing after another with things laid out in a certain amount of space. So yeah, for sure, obviously no surgery, no liposuction, no fat transfers. Yeah.
Gotcha. Okay. But listen, some crazy people out there, myself included. I mean, I had COVID tests out of like the sketchiest van ever, right? I think that if you lived in New York, when COVID first started, it was like very, very official, branded vans. And then you'd walk out of like the Whole Foods and it would be like whatever the opposite of legitimate is.
Janky?
Is what was going on uptown. But you know what? Hey, listen, if you need a test, you need to test. And
if you need a test, you need a test.
I was like, what else you got in that van? But sure, stick a swab up my nose. Right. Okay, got it. So what are the things that you find like in terms of house calls now? Let's get a little juicy. Okay. What are like the most popular things that people are doing?
Yes. So the most popular, at least through Jet Set Beauty RX and my experience with that, have definitely been injectables. So Botox and fillers. Not only that, Kybella. Right? Okay. So for people who have a little bit of excess, submental or, that upper neck, lower chin fat, then that has also been something that has been requested a few times. Vitamin infusions, what I call VitaGlow or Vitamin Glow. So that's just the microneedling in combination with a multivitamin facial infusion for, increased tone, what the French call a coup d'éclat, that just fabulous glow, and frankly, nutrition for the skin of the face. Let's see. Hair growth treatments, not involving PRP as of yet, but there are hair growth treatments that involves, some microneedling as well with infusion of certain, medications and vitamins to be able to stimulate hair growth. So that has also been quite popular. And chemical peels, right? And not the ones that you can find necessarily at the spa or at the med spa, but medical grade chemical peels I also perform through Jet Set Beauty RX.
You know what also just hit me?
What?
Going back to privacy. So, you get, again, I'm just going back to Botox because that's the main thing I do. But like I walk out, New York women, I feel like we don't care, but like I'll walk out.
We are resilient.
Well, you leave bum. I mean, it's not the best. You're walking out. I mean, I certainly put on my big sunglasses afterwards, but it's like, you're going to have lumps and bumps on your head. And if anybody's looking really close, it's, you got to leave the doctor's office. So I'm realizing now that also the benefit of being able to, and a chemical peel, forget it, right? You're going to be red. Microneedling, forget it. I've walked out of a doctor's office after, and I'm kind of like calling my Uber and trying to hide from the Uber to the door because you don't want to be out on the street. So wow, it really just hit me that is a nice way to do it.
A nice option to have.
So in New York City, I'm thinking about this, like, do you do a lot of calls in New York City, or are you like going to the Hamptons, Westchester?
Yes. So I am doing calls in the Hamptons, in New York City, in Westchester, and let's see, other parts of New York State, Hudson.
Oh,
so, yeah.
Wow. Okay. So you're really on the go. Where do you park in New York City?
Well, I have the Jet Set Beauty RX has a commercial license, so I can park. Yes, wink, wink. So I can park where commercial vehicles may park, except obviously at a fire hydrant. And typically, because it is a door-to-door-ish mobile service, typically I will park immediately in front of someone's apartment building, or someone's, if I'm going to the Hamptons, in someone's driveway, or if they're thinking, okay, maybe just a little bit further down, then pretty much I can park in close proximity to someone's door.
Okay, now I have to ask the real question, because I'm just like imagining, I have to imagine that the Hamptons is just a huge draw for you. So let's talk about what do these services start at? And I know that your pricing, and we know that across the world prices vary, right? So New York is going to be more expensive than Iowa, for example, in general.
Yes, of course.
But what is the difference when it comes to mobile beauty services versus maybe just going into your office to get Botox fillers, injectables?
Of course. Well, the mobile service obviously is a premium, and across many industries. When I have someone come and do a blowout at my
Oh
apartment,
yeah.
there obviously is a premium. It's going to cost more than if you were to go to them at the salon. So depending on the service and considering the premium for a mobile aesthetic service, the prices range across all of the procedures that I offer, anywhere from probably $800 to up to $1,600 or more, again, if you
Oh,
stack them on. However, in my office, then things are not as expensive. In my office, maybe things range from $500 to maybe $1,200. And obviously surgery is another story, but we don't do that mobily through JetSet. So yes, it depends on the procedure. It also depends on the distance that I'm traveling, because if I were to stay in my office, then I would be able to see X number of patients. But if I am on the road and I have to travel and drive 3 hours to see you, then I also have to take into consideration the amount of the time that I'm not
sure.
servicing other patients in the office. So for sure, no question, there's definitely a high premium on being able to have the accessibility, the convenience, the privacy, the one-on-one, the cleanliness, the full-on super padded, ultra comfortable surgical chair that fully reclines and fully sits up. So yes,
I mean, it
that
seems
definitely
like
costs.
I would take a road trip in that car just so you could like lay in the back. You know, you also, I'm just going to throw it out here. You're
Yeah.
also forgetting you're paying a premium to have a doctor come, right? So it's
Yes,
not,
yes.
and nothing against our aesthetic nurses who are
Of course.
fabulous and skilled, but there
Of
is
course.
something to be said for having a doctor like yourself who is showing up to do the services.
In
Oh my,
addition to surgery, I actually love these minimally invasive procedures. I value, and I love the interaction with the patient. I love the tactile, the being able to feel the skin and feel the texture of somebody's skin. So I value all those touch points, literally as well as figuratively, because I think they're part of the doctor-patient experience. And any way that I could optimize that, then I'm all about it.
One last question before you go, because it
Yes.
kind of popped in my head again, coming back to these pretty parties and this idea of sort of mobile beauty on the go. I think probably is it important to also make sure that if you're doing this, that your provider, be it a aesthetic nurse or a doctor or whoever's doing this procedure, that you have some access to follow-up care.
Absolutely. And I also perform follow up through Jet Set Beauty RX. So for example, if you came to the office and had Botox, to use our consistent example, in my office, that's fine. But 1 or 2 weeks later, if you thought, oh, listen, I would love for you to do this follow up, but I can't make it to the office for whatever reason, then absolutely follow up is part of the procedure.
Right.
Right. So yes, I think that is important.
Yeah, I'm just thinking like, one of my things that I try to remember to tell people is always things, even in the best of circumstances, can go wrong, right? So, I had a laser procedure that went wrong. It left some burning and some scarring. Where my solace laid in
Yes.
that, it was that I was doing it with a facial plastic surgeon who I
Yeah.
knew could correct and has
Yes.
corrected this, right? So even in the
Yes.
best hands, under the best situations, things can sometimes happen. So you want to make sure if you're doing these pretty parties or with your mobile
Yeah.
beauty that you do have access to follow up care.
Absolutely. But even in
Just
the
in case.
absence, yes, but even in the absence of complications or in the absence of adverse effects, you want the feedback. You want the feedback for yourself. So you get to know your body, your face, your response to whatever is being injected.
Right.
And you also want your injector, again, be it dermatologist, plastic surgeon, facial plastic surgeon, nurse practitioner, physician assistant, whoever, you also want that person, your injector, to be, especially if you're going to have a continued professional relationship with this person, you also want that person to have the feedback, to recognize, this concentration here elevated the eyebrow a little bit too much. That injection there perhaps raised, the lip too high. That feedback is absolutely important. The more information that you can have about yourself and about the injector, and the better educated you are, that if you were to move on or go someplace else or across, or to France or Switzerland, wherever you go, you know who you are, what you want to look like, and what you think you need better than anyone else.
Oh my goodness, I absolutely love this. Dr. Madhère, if people are in the New York-ish area and they're interested in getting in touch with you for Jet Set Beauty, where should they go?
They should definitely go online to the site, jetsetbeautyrx.com. And within that website, you can make a reservation, ask me a question, do anything.
And see the full list of services, which actually I saw added COVID because of the time we're living in, you added COVID. So thank you for that. And in terms of your holistic plastic surgery, that's based in New York. So is that, are you doing everything there?
Yeah. So basically in my practice and my brick and mortar space, I have full plastic surgery services, including some of the services that I offer through Jet Set, but that is my practice where I have been practicing for several years. And so, yes, that becomes a place where we consult for not only injectable procedures and minimally invasive procedures, but surgery as well.
Oh, so like what kinds of surgery really quickly? Everything?
Full on. Yeah, full on. Pretty much. I don't do buttock implants, but pretty much everything else. Breast reduction, breast lifts, breast augmentations, facelifts, neck lifts, noses, eyes, liposuction, tummy tucks, thigh lifts.
Oh my gosh, I love
body
it.
lifts. Like, I'm very extensively trained.
Some people will like pick up Vogue. I love to just peruse Real Self, right? And I'm like, oh, wow, look at this. Because the technology is always changing. It's getting better and better. And what we can do is so incredible. And tell us, if we want to tune into your Forever Fab podcast, where can we find that?
Well, the Forever Fab podcast is pretty much everywhere you listen to your favorite podcast, including yours. So iHeartRadio, Google, Amazon, Apple. So we are in lots of places. And thankfully, my podcast is, as yours is, international. So I'm grateful to my international listeners as well. And Forever Fab talks about actually not so much plastic surgery, but the FAB is an acronym for fashion, the art of wellness, and beauty. All things along the beauty spectrum.
I love that. Wonderful. I was looking because I saw on your website that it was F.A.B, and I was mentally going to ask you what that is, but thank you for that. And I do want to just shout out right now for both of our listeners, yours and mine. Take a second and go and review us on Spotify, on iTunes, wherever you do this. It takes a second for you. It means the world to us. And you know what? I've actually learned things from my comments, good and bad.
Yes.
I welcome them all because it helps us get better at what we do. So
absolutely.
If you like what you're hearing, go give us a shout out. Dr. Madhère, such a pleasure to have you. Thank you so much for being on, spending your time with us today. If you listening at home have any questions you want me to pass along to Dr. Madhère or her team, I'm always happy to do so. You can email me at hello@artbeautypodcast.com. You can find us on Facebook, Instagram, and right here on YouTube at Art Beauty Podcast. And like we say, we will see you next Tuesday, maybe in a mobile van.
Maybe. Stay beautiful, Amber. Thank you.
Bye.
Bye.